you very much for allowing me to tell you a little bit about breast augmentation. I really enjoy doing breast augmentation because for the woman it's completely transformative. They really get to change their shape, their appearance, and how they feel about themselves, essentially in just an hour or 2 hours. This kind of surgery I don't do in my office. I do a lot of procedures in my office, but anything that requires IV sedation or general anesthesia, like a breast augmentation or tummy tuck, I do at a surgery center, and that's a great facility. You absolutely go home right away. The operation will take usually an hour for a straightforward breast augmentation, a little bit longer if I need to do a lift, and you'll be on your way 30 to 60 minutes later once you're awake and alert. After a breast augmentation, you can return to work, usually 4 or 5 days later, and I let you start exercising about 7 days later. But I'll give you some guidelines as to what you can do and cannot do. You're back to full activities after 4 to 6 weeks. It's important to know that when you do a breast augmentation, I almost 100% of the time will place the breast implant beneath the muscle. And the muscle I'm talking about is the pectoralis muscle, your chest muscle. There's 4 reasons why I like to do that. It feels more natural as ever feel in your breast. When you get mammograms, as you know, they sort of squish your breast between 2 plates. So if the implant's behind the muscle, you get a better breast augmentation. Third reason, it's a much more natural look. And the analogy I like to give all my patients is if you put a grapefruit on your bed and you put a sheet over it, which is like the skin, it just looks like a grapefruit with a sheet over it. If you put the implant behind the muscle, it's like putting a grapefruit on your bed with a blanket or duvet. It's a softer look, it's not that stripper look that people get. And the last reason is very important. Anytime you have a foreign body in your body, whether you have a sliver in your foot, a knee replacement, a hip replacement, or a breast implant, your body will always know that's not me and will produce scar tissue around the implant. That's normal, that's healthy, and that happens to all of us. One of the potential complications of a breast augmentation is you can form too much scar tissue. If you put the implant behind the muscle, that's much less likely to happen. Doesn't mean it can't happen, but it's very unusual in my practice to need to reoperate on somebody because of hardness. So basically, almost 100% of the time we'll put the implant behind the muscle. Patients wonder how to choose sizes. Different doctors have different ways of doing this. I think the most effective way is I recommend you go to a site such as Implant Info, which has thousands and thousands of pictures of women before and after surgery without their shirts on. What I have all of my patients do is find a woman that looks like them before their surgery and then find a result they like after surgery, and then they email me the link. And if I put the same size implant as that woman did whose picture you like, you'll almost certainly get a very, very similar result. So in my hands, I think that's one of the most foolproof methods of choosing an implant size. There's 2 primary incisions that I utilize. About 80% of my patients will do a periareolar incision, which means it's the lower part of your areola, and that scar is almost invisible from day 1. And about 20 to 25% of my patients prefer to have an inframammary incision, which means it's a small incision on the lower part of your breast but above the bra line. Both incisions work equally well for me and equally well for the patient. It's really just their preference. In either case, they can breastfeed, so it's really personal choice. I always use dissolving sutures. There's no drains, so I make it as easy as possible. The only dressing is a very tiny Steri-Strip. The question of saline versus silicone, that's one that I really like to talk to you in person, but in general, silicone is going to give you a much more natural feel. The silicone implant's a little more expensive. I use what's called a Keller funnel, which allows me to place the silicone implants through a much smaller incision, and in almost all women, I'm able to place the silicone implant through a periareolar incision if they want to. So in general, I'll recommend silicone for the vast majority of patients, but not for everybody. The last thing is everybody has different questions, and the whole questions of lifts are more complicated. I really need to see you in person to discuss this, so I would encourage you to make a cosmetic consult. I spend 45 minutes with you discussing breast augmentation. I'll answer all of your questions, and it's a real chance to see you in person to go over any questions you have and make a personalized recommendation